Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NIC VD, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am 𝐻𝐚𝐤𝐻𝐚𝐬𝐭𝐚𝐧. It is my honor and privilege to welcome you all in Pakistan Cardiac Super League Season 3. After an incredible opening match, we are once again live for the second match of Pakistan Cardiac Super League, which is going to be played between two teams from the Group B, AFIC Lions and Dow Dolphins. As always, this event is a proud collaboration with Pakistan Cardiac Society and is powered by Wilson's Pharmaceuticals. Before diving into the match, I would like to express my deepest appreciation for the esteemed council members and umpires of Pakistan Cardiac Super League. Their wisdom and guidance have made this event a success. Today, we are once again blessed to be in the company of these guiding and shining stars of cardiology, and we are pleased to welcome Professor Mohammad Ishaq Saab, Professor Hafizullah Saab, Professor Fawad Farooq Saab, Professor Javed Akbar Syal Saab, Professor Amber Ashraf Sahiba, and Professor Abdul Hamid Siddiqui Saab. Now, let's get ready for the action. And I'm pleased to introduce a person whose exceptional moderation has made every match an unforgettable experience. You all are familiar with the name Dr. 𝐏𝐚𝐤𝐲𝐬𝐭𝐚𝐧 Saab, and I would now request Dr. 𝐏𝐚𝐤𝐲𝐬𝐭𝐚𝐧 Saab to officially start the proceeding of today's match. So over to Dr. 𝐏𝐚𝐤𝐲𝐬𝐭𝐚𝐧 Saab.
So thank you very much, Hamza. It's great to be back, and yes, I would like to take this opportunity to welcome you all to this amazing third season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. So we did start the first match with a bang. We had a wonderful game, and I think we all thoroughly enjoyed. Today, again, we have two extremely important teams which are going to be up against each other. So we have our AFIC Lions from Rawalpindi, and they'll be up against Dow Dolphins from Karachi. So let's hope that it's going to be a wonderful match, and in fact, all the matches are always quite entertaining for all of us. With this, I would also like to take the opportunity to welcome our highly esteemed umpires and faculty members. And for today's match, as we all know, our umpires are the ones who are actually holding it together. So we do have Professor Mohammad Ishaq Saab. Welcome, sir. It's great to have you with us today for this match. We also have our second umpire, and he has been also one of the key members of Pakistan 𝐏𝐚𝐤𝐢𝐬 Super League. It is Professor Abdul Hamid Siddiqui Saab. His umpiring has been quite amazing in the previous leagues as well. We are going to have more faculty members coming up, and I think we'll have the introductions as they come in. But I do see Professor Zahoor Khattak Saab. Welcome, sir. It's great to have you. And I think we'll have more faculty members joining in. So, and yes, I've just been informed we have the coach of AFIC Lions, Colonel Azhar Ali. He's with us. So welcome, sir. I hope your team is ready for the match, and we are all excited. So as you know, this league is growing. Every day, every match, and every year we have something coming in, and it's the third season. So this year we have introduced something else as the canvas is growing. So previously only the two teams which used to be on display on that side of the screen were up against each other and they were answering the questions. Now we have other teams which could be on the other side of this perspective of the screen, and they could participate as well. So today we have introduced as a pilot show, I think we are going to start with the first two institutions, and we have NICVD and Khyber Teaching Hospital. So their teams, their players will be able to answer the questions on their respective gadgets, and I think somebody will be giving them the feedback, and maybe in the end we'll be able to show the board where we may have the leaders with us. So I think this is a new dimension which is going to come into this wonderful league. So the two teams are there. Can we have the teams on the screen? And I would like the captains of the two teams to introduce their teams, and I think we'll start first of all with AFIC Lions. I think I can see them there. Yes, can you see me? Lions.
Yes, we can hear you.
Okay, so Captain, please do the introductions.
All right, I'm Dr. Shahir Farhan, and I'm the captain of the AFIC Lions. Here I have Dr. Tahreem Ashraf, here I have Dr. Huma Mushtaq, and here I have Dr. Maria Nazir.
So welcome to this league, welcome to the show, and best of luck for the match today. All right, so can we have the Dolphins on the screen? And I do see the captain setting up the mic. Start the introductions.
Assalamu alaikum. I'm Dr. Hera, and to my right is Dr. Muniba, and to my left is Dr. Hera and Dr. Hafsa.
Okay, welcome to the show. Are you ready for the game?
Yes, sir.
Wonderful. Best of luck to you as well. So the conditions, yeah, the sun is shining bright. I think the pitch is going to be pretty good, pretty decent. It's going to be a bit bouncy, and I am expecting good scores. So with this, I'll take the permission from the faculty members, and I've just been told that Professor Hafizullah has joined us. Sir, great to have you. Yes, I can see him now. Sir, welcome to the show yet again.
Thank you very much. Thank you. Best of luck. Best of luck to both teams.
Thank you very much, sir. So the teams are there, and do we have the permission to start the game?
Yes, please.
Thank you. So can we have the coin toss on the screen, please? It's an electronic toss of the coin. I'll randomly ask one of the teams, Dow Dolphins. What do you want? Do you want heads or tails? Heads.
Heads, sir.
Okay, roll the coin. Here we go. And it's a heads. So Dolphins, that's a good start. Very good. So I'm going to pose you with two questions as per rules of the game. The first one, do you want to throw the questions or you want to take the questions?
We want to take the questions, sir.
All right, so they've decided to take the questions. Question number 2, you want case scenario A or you want case scenario B? want A. Okay, so the news from the center is Dow Dolphins have won the toss and they want to take the questions and they have selected case A. Okay, well, this is how we roll, and I think in order to give equal chance to both the sides, we have to ask these questions in all fairness. And with this, we are now going to move to the first innings. So can we have the first scenario on the screen, please? And I will request AFIC Lions to read the questions and the scenario rather out loud, and then we'll have the question one.
Case A. A 62-year-old man, hypertension, type 2 diabetes, smoker, presents 2 hours after squeezing retrosternal chest pain with diaphoresis. ECG horizontal ST depression in V4 to V6 and T-wave inversions in AVL. High sensitivity troponin T at 0 hours is above the 99th percentile. A 3-hour repeat shows a significant rise. Gray score is 152. He is hemodynamically stable. Coronary anatomy is unknown. The cath lab can take him within 12 hours.
Okay, so teams. So you've got Dolphins. You've got a couple of seconds. So we do hear some crosstalk here. Please mute everyone else. Only the answering team should be unmuted. So you've got a couple of seconds, Dolphins. Let us know when you're ready. And we'll start with the first question then. And I'd like to welcome Professor Javed Akbar Syal. He's a very important faculty member. So welcome on board, sir. Welcome to the show.
Thank you, Hamza.
Okay. Thank you, sir. Thank you and welcome. So can we have the first question on the screen, please? Okay. Read the question, please. FIC, Lions.
Question number 1. Which troponin algorithm is the recommended best option to rule out or rule in NSTEMI?
And the options as well. Please read the options.
Blur.
Read the. Okay, can you read it? Lions.
Option A, 0 hours conventional troponin algorithm. हमारी स्क्रीन पे ब्लर आ रहा है.
Okay, technical team.
Legible नहीं है.
Can you put it right? I think they must be having some internet issue. The technical team is on it. So meanwhile, I think I'm going to go through it. So we have option B, single undetectable high sensitivity troponin at presentation. Option C, ESC 0 hour to 1 hour high sensitivity troponin algorithm. Option D, ESC 0 and 3 hour conventional algorithm. E is serial CKMB at 0 hours / 3 hours. And your 60 seconds start now. The answering team, to unmute the mic, we want to hear your discussion. Dolphins, we can't hear you. Can we see Dow Dolphins? Okay, what's wrong? Hold on, hold the timer. Dolphins, can you hear me?
Yes, sir, we can hear you.
Okay, so but we can't see you. Technical team, what's the issue?
Issue with the video, I suppose.
Okay, so start the timer then. Okay, so you've got 20 seconds left almost. Come on.
Option C, sir.
Are you sure about option C? C Charlie.
Yes, sir.
Okay, they say they are sure. Lock C Charlie. And yes, very right, very good answer. Well done. So even in the light of some technical issues, under stress, under duress, you've come up with the right answer. Very well done. Great going. First 6 of the match, and that's what we wanted. All right. Question number 2 on the screen, please. AFIC, read the question.
The screen is still blur on our side. We can't legibly read it.
Okay, so till that time, I'm going to read it myself. So question number 2 is, in this patient with high Gray score and positive troponin, what timing of invasive angiography is advised? Option A, immediate, less than 2 hours regardless of features. Option B, within 24 hours, early invasive strategy. Option C, selective angiography after stress testing. Option D, after 72 hours, delayed. Option E, only if recurrent angina develops, and your 60 seconds are on your screen.
Within 24 hours, early invasive. It's option B. Sir, option B.
Option D, delta?
Within 24 hours. Early
Okay,
invasive
option B. Okay, option B, beta. So, are you sure about it?
Yes, sir.
Okay, they have tried to flick it over the long on boundary. Let's see what happens. Lock B, beta. Option B, lock it. And yes, another right answer. You flicked it well. Wonderful. I do see a Mark Waugh in you. He used to flick really well off his legs. Great, great stroke making and great answering. I think you're absolutely on course with this, and I'm looking at a big score. All right, can we have a hat trick of 6s? Question number 3 on your screen.
Routine
Lions.
pre-treatment with a P2Y12 inhibitor before knowing the coronary anatomy in NSTEMI plan for early invasive management is option A, class 1 recommended. Option B, class 2A should be considered. Option 3, class 2B may be considered. Option D, class 3 not recommended. Or E, left to operator preference.
Okay, 60 seconds on your screen now.
Early invasive का मतलब जो होगा वो class 2B के बाद may be considered.
2025 में जब इसके नीचे कर दिया
Approaching 25 seconds. Are we going to see a hat trick of 6s? Let's see.
Sir, class 2, option C.
C, Charlie, right? You want me to lock it?
Yes, sir.
Are you sure about it?
Yes, sir.
Okay, they are sure about it and they've been pretty sure so far. Lock C, Charlie. Oh, and that's the first mistake. So we didn't get the hat trick of 6s, but never mind, you still will have your chances in the next few deliveries. Okay, moving to question number 4.
Question 4. For a NSTEMI ACS patient not anticipated to undergo angiography within 24 hours, the preferred parenteral anticoagulant is A, unfractionated heparin alone for entire stay, B, enoxaparin subcutaneous, C, bevalirudin infusion, D, argatroban, E, fondaparinux.
60 seconds. Start now.
Throughout the stay, जो हमारे पास होता है वो enoxaparin हम usually prefer कर रहे हैं subcutaneous.
preferred is
Unfractionated नहीं तो हम stay के लिए तो नहीं पर enoxaparin subcutaneous bivalirudin का हमारे पास जब
इसमें ये लिखा हुआ है कि not anticipated to undergo
Approaching 25 seconds.
तो फिर enox भी दे सकते हैं unfractionated heparin भी आपके पास entire stay
20 seconds.
तो फिर enoxaparin
Okay, it's an outswinger. They're trying to
Sir,
cut
option
it.
B.
Option B, beta. You want me to lock it?
Yes, sir.
Okay, they are going to cut this delivery. A ball moving away. Let's see where it goes. Lock B, beta. Oh, and this one took the edge into the slips and caught. Oh, it was moving away. All right. So 2 misses now and 2 correct answers. You've got to be watchful. Question number 5 on your screen. Lions, go ahead.
Question number 5. Which antiplatelet default after PCI for ACS is recommended for 12 months absent contraindication? Option A, aspirin plus clopidogrel. B, aspirin monotherapy. C, ticagrelor monotherapy from day 0. D, aspirin plus ticagrelor, or E, triple therapy with OAC routinely.
Timer starts now.
Aspirin is now preferred after वो वाला उसकी क्लास थोड़ी नीचे हो गई है
एस्पिरिन पे ticagrelor जो है वो करके कर लेते हैं बस। तो बस फिर D का option D aspirin plus ticagrelor cold strategy after the PCI रखेंगे। Sir, option D.
Okay, are you sure about it? Should I lock D delta?
Yes, sir.
You want me to lock it? D delta.
Yes, sir.
Okay, very quietly, calmly, they are saying lock it. They're not too sure, I think, but they want me to lock D delta. Okay, so I'm going to lock. You're sure?
Yes, sir.
Okay, D delta, lock it. And you're absolutely right. You should have shown more vigor and confidence, because yes, that's the right answer. You were going for the right answer, and this one is wonderfully played, and that's definitely a 6. So you've got 3 6s now with a score of 18, and we are just halfway through with your innings. And question number 6 is coming right away. Lions.
Question number 6. In NSTEMI ACS, patients undergoing PCI after pre-treatment with ticagrelor, the guideline recommendation regarding routine use of IV cangrelor is A, recommended to replace ticagrelor preloading. B, should be considered in all ACS undergoing PCI. C, may be considered in P2Y2 naive patients only. D, not recommended if ticagrelor already administered. Or E, should be given in all high thrombus burden lesions.
Start the timer.
it's naive patient में जब हम देखते हैं कि because उसमें inadequate
Wait, my
thrombus burden high तो होगा but IO
Tyro के दे हमारे स्कूल में कुकिंग टू भी इनोवेटिव के भी करके हो जाता है ना आयुर्वेद के लिए अभी तक
So it's a cross seam delivery. Let's see where it goes.
it's not recommended for me but it may be
in a patient's with an
so it's C.
Approaching 25 seconds.
option C.
It's C.
Sir, option C.
Okay, you want me to lock C Charlie?
Yes, sir.
Okay, I'm going to lock C Charlie. Lock it. Oh, that's a miss. All right, all right. So we've missed another one. Okay, come on, Dolphins. We need a good score from you. Okay, you still have 4 more questions to go. You can still put up a good total. Focus, and you have your next question, question number 7 on the screen.
Question number 7. According to OASIS 5 trial data, the relative reduction in major bleeding with fondaparinux versus enoxaparin in NSTEMI ACS was approximately A, 10%, B, 25%, C, 40%, D, 50%, or E, 75%.
The timer starts now. 60 seconds on your screen. Okay, they've come down the it. I think they want to go for a big 6, but they're not sure about the spin. Let's see.
There was a 25.
25 seconds. 15 seconds. Dolphins.
Sir, option A.
Option A, alpha. You want me to lock A, alpha?
Yes, sir.
Okay, they are saying lock A, alpha. They're trying to get to the pitch. It could go anywhere. They're not sure where the ball is turning. I think they're not really sure as well. Let's see what happens. Lock A, alpha. And yes, they've missed it. Okay. So they were quite excited as well. I could hear a few laughters, and clearly they had no idea where it was going. All right, never mind. These questions, these percentages are never that easy. Okay, question number 8 is on the screen. Go ahead, please.
Question number 8. In patients with NSTEMI ACS who receive subcutaneous enoxaparin more than 8 hours before PCI, the recommended additional intraprocedural anticoagulant is A. Enoxaparin 0.1 milligram per kg IV bolus, or B. 0.2 milligram per kg IV bolus, C. 0.3 milligram per kg IV bolus, D. 0.4 milligram per kg IV bolus, or E. 0.5 milligram per kg IV bolus.
60 seconds on your screen. Come on, Dolphins. Twenty-five seconds. This one again is a spinning delivery, a flighted one. 15 seconds. Dolphins. Approaching
Sir,
10
option
seconds.
C.
Okay, you want me to lock C, Charlie? Should I lock
Yes,
C,
sir.
Charlie?
Yes, sir.
And you're sure or unsure?
Not exactly sure for it.
Not exactly sure. Okay. Lock C, Charlie when they are not exactly sure. C, Charlie, lock it. And yes, that's the right answer. You should have been more sure there. Well done. You got to the pitch and hit this one for a 6 over long off. Well done. This is, yes, come on, keep the confidence up. You can still put up a good show, a good total. And we are all hoping for that. Okay. We have the second last question. Question number 9 on your screen, and read it, please.
Question number 9. In the ESC 0R/1R high sensitivity troponin algorithm, the proportion of rule-out patients who had acute MI at 30 days in validation cohorts was A. less than 5%, B. 1 to 2%, C. 3 to 5%, D. 5 to 7%, or E. 10%.
Start the timer.
लोअर प्रोपोर्शन होगी जब इन्होंने किया होगा
तो लो प्रोपोर्शन 1 to 2% हमारे पास होगा फिर
2% बिकॉज ये 0 to 1 आवर्स में इन्होंने रोल आउट किया था तो ये फिर गाइडलाइंस में आया तो इट मींस कि इसके लोअर प्रोपोर्शन 1 to 2.
Come on, you have to cross the 30 marks barrier. 25 seconds.
1 to 2%. Validation cohort.
15 seconds. Come on, Dolphins.
Less than 0.5.
10 seconds. Come on, less than 10 seconds now. Go for it.
Sir, option A.
Option A, alpha. Okay. So They are saying option A, alpha, and we're out of time now. Lock A, alpha. And yes! Wow! So that's, you heaved it in the air and it got the best, better half of your bat, and I think that's out for a big 6. Well done. So were you sure about it?
Yes, sir.
Yes. That it didn't seem so, but still well played. So, all right. So with this, we're going to move to the last question of this first innings. Question number 10.
Question 10. When using prasugrel in end-stem ACS, the dose adjustment for body weight less than 60 kg is A. Not necessary, B. Reduce maintenance dose to 5 milligrams OD, C. Reduce loading and maintenance dose by half, D. Avoid prasugrel entirely, or E. Switch to clopidogrel.
And 60 seconds are on your screen. I'll request everybody else to be muted, please. The team answering the questions to be unmuted. Okay, last question. Let's see. Can they score 36? That's the question.
CV और TI है.
CV और TI के अंदर नहीं जाके देखा, बट ये कि बाकी दो
25 seconds.
लोडिंग नहीं रिड्यूस करते हैं.
तो रिड्यूस मेंटेनेंस डोज जो है वो लेस देन 5 को कर देता है. ऑप्शन बी के लिए वो
15 seconds. 9 seconds. Come on. 8. Hurry up.
ऑप्शन बी.
Which option? D delta.
नहीं, बी बॉल.
B. Okay. B beta. B for ball. Absolutely right. She wants me to lock B beta. So hold on. How sure are you this time? Again, very sure or unsure?
Not very sure.
Okay.
Not very sure.
But they're always sure to some extent. Yes. So lock B beta. Let's see. And again. Wow. This one also got the better half of the bat and went for a 6. Well done. Very well done. And I think now we are getting into that competitive zone. And yes, we are almost halfway through. And they have put up a decent score, I would say, by giving 6 correct answers, 6 sixes out of 10. And they've got a score of 36. So great going. I think you've still done pretty well. AFIC will be coming pretty hard at you. So I think we've got a wonderful match in the making. And again, best of luck to both the teams. With this, I move to our umpires. Professor 𝐏𝐸𝐶 Saab, sir, your thoughts?
Assalamu alaikum. First of all, I would like to extend my salam to Hafizullah and other colleagues who have joined us. And I think they played well, they fought well. I just want to make a point that the percentage question is always quite difficult. And the answer is mostly based on a guess rather than actual knowledge. So I would like to communicate to the scenario setters that please avoid these percentage answers and questions and replace them with other questions, other possible answers which are more knowledge of test rather than guess. Other than that, I think they could have played better, but well done. 36 is not a bad score, but let's see how the FIC does. But one thing is very clear that it's a great learning exercise for all of us, and the guidelines and the percentages need to be remembered. We were lucky, me and Hafizullah, we have practiced during a time that we were not bound by these strict, stringent guidelines and percentages. So we had a lot of liberty, but that liberty is now withdrawn. And I think they should be equipped with this kind of answers in future. So thank you for having me. And I think Professor Hafizullah can be seen with his Nurani chehra. Let him make some comment. And I hope that he will endorse my view that percentage answer should not be in the scenario. Thank you.
Thank you very much, sir. I think the feeling is absolutely mutual, and we all feel in the same way, and a point very nicely highlighted. And I think I'm going to move towards Professor Hafizullah Saab. Hafizullah Saab, sir, great to have you, like always. Sir, we can't hear you. I think you're... Sir, you'll have to unmute yourself. We can't hear you. Okay, you can't hear us as well? Okay, you can, but we can't hear you for some odd reason. Okay. So maybe there is some technical issue.
Hafiz unmute kare na.
I was trying to, but I think Assalamu alaikum.
Okay, sir. Yeah, we got you now.
Right. Okay. So the organizers had muted us, so they kept us muted so that we cannot, talk. I think this question is very, very important, and it was very relevant, because if there is something as must know, this sort of a scenario of acute MI STEMI is something that everybody should know. And I think the question was very nicely conceived and crafted. And I would sort of differ here that probably we need to know figures, because we need to know that Fondaparan X as versus the other one, how much benefit it accrues, and everything lies in the figures nowadays. So figures perhaps have to be there, percentages have to be there, and I'm afraid people have to learn to live and learn with percentages. Very nicely conducted by Hamza in a very enthusiastic way. But only one comment, that why is it that AFIC could find only one lion and 3 lionesses? I think the competition becomes more tough now. Thank you.
Very right, sir. I think, again, extremely valid points, and 2 stalwarts, I think, giving their views. Again, I think at times you have figures which are important, because if you don't look at the figures, we cannot have the interpretations, we cannot compare things. So it's the figures actually which enable us to see the differences. But then, having said that, at times you have scenarios and cases where you apply your minds more. So yes, so it has to be a balance of everything, and that's what the whole team is trying to do. And we also have another umpire. He's extremely important, and he's always there for us. It's Professor Abdul Hamid Siddiqui Saab. Sir, are you there? We do see Siddiqui Saab connected. Can you hear me, sir? Siddiqui Saab?
The organizers have to unmute. The organizers have to unmute. They have muted everybody.
Okay, sir. Now they're telling me they cannot mute anyone, and neither can, I think they can still unmute, right? So Siddiqui Saab is there, I think, but we somehow can see him. But I don't know if he's there and he's listening to us. So anybody else?
Zahoor Khatak was there.
Sir, I think Zahoor Khatak Saab, are you there? No, Zahoor Saab is also not there. We are trying to get in touch with him. We are also trying to get in touch with the Siddiqui Saab. So with this, sir, do I have the permission to move into...
It reminds me of some of our class fellows के जो हाजिर लगा के गायब हो जाते थे, तो ये भी हाजिर लगा के गायब हो गए.
Exactly, अपनी proxy खुद लगा के चले गए. Good.
They must have gone for a golf match. They're both very good golf players.
मुझे और हफीजुल्लाह साहब को छोड़ गए, और तो पता है कि ये पेशावर वाले लोग भागते नहीं है, बाकी तो ये आके ये नाम लिखा के तो गायब हो जाते हैं. और हफीजुल्लाह साहब ने भी रियलाइज किया, मैंने भी किया कि दोनों तरफ लड़कियां, एक राजेंद्र बैठा बीच में. So,
sir, this was the same scenario in the last match as well. If you remember, I mean, we've been having more girls off late.
He's looking an odd man.
Have more cardiologists, ladies in the future than men.
So I think if we fell sick, then I think we'll be treated by one of the female cardiologists. it looks like.
And why not, sir?
Inshallah.
They are doing wonderfully well now, even in
Yes,
intervention.
excellent. No doubt.
So I do believe Siddiqui Saab is there. Siddiqui Saab?
और नहीं भाई गाँव के लिए चले गए वो लोग.
Okay, sir, I think now we'll move to the second half. And so we are ready for the second half. All right, can we have the scenario on the screen? Put the case on, please, and I'll request the team to go ahead and read it. Dolphins.
A 79-year-old woman with CKD with an estimated GFR of 28 ml per minute per 1.373 meters square, anemia and frailty presents with prolonged chest discomfort. ECG shows T-wave inversions from V2 to V5. A high-sensitive cardiac troponin I was mildly elevated. 1 hour delta is small. She is in pain-free now. Grace is 128. The nearest PCI center can accept her tomorrow afternoon after 24 hours. She has a history of epistaxis on dual antiplatelet therapy.
All right, Lions, you have a couple of seconds to gather yourselves. Let me know when you're ready. Okay, so are you ready?
Yes.
Okay, so the first question on your screen, Dolphins, go ahead and read it.
For the NSTEMI ACS patients without very high or high risk features, the guideline recommends A. Immediate invasive strategy of less than 2 hours, selective invasive approach after the ischemia testing, C. Mandatory PCI within 24 hours, D. Routine fibrinolysis, or E. Emergency cabbage.
And the timer starts now. You have 60 seconds to answer.
Beta. Answer beta B.
Okay, so you are sure about it. You're going to pull it for a 6. Let's see whether it goes over the boundary. So B beta, should I lock it?
Yes.
Okay, lock B beta. And yes, you start off by hitting and pulling the delivery for a 6. Very well done. Well played. That's the kind of start we actually needed. Well done. All right. Question number 2 on your screen now.
If PCI is performed and the patient had prior fondaparinux, you should A. give no additional anticoagulant, B. stop fondaparinux and start bivalirudine, C. reverse fondaparinux, D. give a full dose unfractionated bolus at PCI, and E. start a gatrobatran infusion.
And the timer starts now.
Fondaparinux से जब thrombosis होता है तो delta D. Give full dose unfractionated heparin bolus.
Okay, so they're coming down the wicket. I see a bit of Afridi in them. You want me to lock D delta?
Yes.
I'm sure Ishaq Saab is not happy right now, but I'm going to lock it. D delta, lock it please. And yes, you're again right. This one is a big 6 and it's a straight 6. Very well done. Very well played. Good going. And we are inching towards the score, and the score to beat rather is 36. Okay, so question number 3 is on your screen. Read the question, please.
In NSTEMI ACS patients not expected to undergo early invasive strategy and without high bleeding risk, P2Y12 pre-treatment may be A. mandatory, B. not recommended, C. may be considered, D. class 1 contraindicated, or E. only after angiography.
Timer is on your screen.
Maybe consider. Maybe consider.
Not sure.
Contraindicated नहीं है जो कहते हैं
not recommended, so definitely not. Class
That's a swinging delivery. Let's see how they negotiate that.
May be considered.
Final. Final. Charlie may be considered.
Okay, are you sure about it? You want me to lock it?
Yes.
So he's trying to flick it towards mid-wicket and square leg. Let's see. So C, Charlie. Okay, locking C, Charlie. And yes! So that's a hat-trick of sixes. Very nicely played. They seem to be pretty confident, pretty sure. And they're getting closer and closer to that total of 36. All right, so no mistakes so far. It's a 100% record. Let's see what happens on question number 4.
Bivalirudine is considered an alternative to unfractionated heparin in ACS patients with A. extreme obesity, B. prior stroke, C. heparin-induced thrombocytopenia history, D. concomitant warfarin, E. severe anemia.
And the timer is on your screen. 60 seconds.
से होती है heparin thrombocytopenia. Bivalirudine is fondaparinux सब नहीं करते PCM bivalirudine होती है. heparin अगर नहीं करते PCM है. C, Charlie.
Okay, are you sure about it? You want me to lock C, Charlie?
No. No. Lock.
Okay, they are sure. They want me to lock C, Charlie. Lock it. And again, that's another correct answer. 4 in a row. Very well played. Although this one straightened a bit, even then it was played very well. So great going, team. Lions, I think it's great going. But still, Dolphins, anything can happen. Never lose heart. Okay, question number 5 on your screen.
Medically managed NSTEMI ACS patients with high bleeding risk, the Twilight elderly sub-analysis suggested that after 3 months of dual antiplatelet therapy, switching to ticagrelor monotherapy compared with continuing DAPT. A. Reduced bleeding without increasing ischemic events. B. Increased bleeding and reduced ischemic events. C. Reduced bleeding but increased ischemic events. D. Had no difference in bleeding or ischemic events. And E. Increased both bleeding and ischemic events.
And the timer starts now. 60 seconds.
Indication आई है ना.
Okay, so they've brought the slow bowler, I think.
Bleeding risk कम करेगी.
Ticagrelor का bleeding risk
Switching to ticagrelor monotherapy reduced bleeding.
compared with continuing DAPT.
Bleeding risk को improve करेगी. Increase करेगी. ischemic तो कहते monotherapy आती है.
Reduce bleeding without increased bleeding. Reduce bleeding without increasing.
Approaching 25 seconds.
A alpha.
Okay, are you sure about it?
Yes.
So they think that they've gotten to the pitch of this delivery. It's a spinning ball. They want me to lock A alpha. Okay, lock A alpha. And it's a 6 again. What a stroke. Very well played. And it's a beautiful stroke over extra cover. I think they're really playing it very well. Their discussions are pretty spot on. And they are deciphering everything beautifully. Very well done. Great going. Okay, so they've come to a score of 30. They need 1 to make a score of 36 and level it. And they would need another one to win. So they still have half of the questions left. They only need 2 right answers to win. All right. Next question, question number 6.
In NSTEMI ACS patients with severe CKD with an eGFR of less than 30 ml per minute, the guidelines recommend fondaparinux. A. Class 1 recommendation. B. May be considered if no alternative. C. Is contraindicated. D. Dose reduced to 1.25 milligrams subcutaneously daily. Or E. Only if unfractionated heparin is unavailable.
Timer to be started now.
Fondaparinux में dabigatran और polypropyl.
Dabigatran total anticoagulant.
The guidelines is fondaparinux. Fondaparinux की contraindication क्या है? Single नहीं लेनी और दूसरी
PCI में contraindicated as
Again, it's a spinning delivery. Let's see if it's a googly or not.
Option C, Charlie, it is contraindicated.
Okay, so you want me to lock C Charlie is contraindicated.
Yes.
Okay, they are confident. They want me to lock C Charlie. Lock it. And yes, they are rightly confident. All the way I could see the captain leading the way, saying it's contraindicated, and he was sure about it. As solid as a rock. Very well done. Great answer, great logic, and great going. So with this, we have come to a score of 36 apiece. Great. You just need one correct answer to get going. But then again, you see, it's always best to score as many right answers as possible, because it's always going to get to that net percentage of right answers, and you may need that. Okay. Can we have question number 7 on the screen, please?
In patients with AFib and NSTEMI ACS for greater than 12 months after the index event, the default long-term antithrombotic regime is oral anticoagulant plus clopidogrel, aspirin alone, oral anticoagulant alone, dual pathway inhibition with rivaroxaban plus aspirin, and ticagrelor monotherapy.
And the timer starts now.
Good. C, OAC alone.
Oh, this
Charlie.
time he's come down. And he wants to go for a 6. Afridi, which one?
C, Charlie, OAC alone.
Okay, C Charlie, OAC alone. He wants to make no mistake about it. Lock C Charlie. And yes, it's a 6. He's gotten this one on a full toss. Very well played. Huge 6. And I like the confidence. Good. So Lions, you're roaring at the moment. And they haven't even dropped a single question. 3 more to go. It's getting interesting now. And we also know that they have taken over Dow Dolphins, and actually technically they've won this game, but still, it's important for them to score as much as possible. And Dolphins, never lose heart, because even your participation and the way you've played, we've all enjoyed it, and we are still enjoying it. And we are all learning. Good. Question number 8 on your screen.
In NSTEMI ACS patients with high bleeding risk undergoing PCI, which default DAP duration is supported by the guideline if ischemic risk is not high? 1 month, 3 months, 6 months, 9 months, or 12 months?
And the timer is on your screen, 60 seconds.
I'm bleeding risk. This is not
Charlie, C, 6 months.
Charlie, 6 months. You want me to lock C Charlie?
Yes.
He wants to go for a ramp shot. Is the 𝐾𝐚 𝐤𝐬 this time? I don't know. Okay, lock C Charlie. And that's the first mistake. First blemish. Oh my God. So, here comes the first mistake, and this one they've gotten it wrong, but I tell you, they've really played very well. Well done. Very well done indeed. Never mind. So moving to the second last question of the innings and the match, question number 9.
In older ACS patients, the guideline states that clopidogrel may be considered over potent P2Y12 inhibitors primarily because A, it is cheaper, B, it reduces the bleeding without excess ischemic events in this group, C, it is more effective in preventing the stent thrombosis, D, it avoids dyspnea, and E, it has fewer drug-drug interactions.
60 seconds on your screen now.
You see bleeding without excess ischemic events in this group, okay, or दूसरा it has fewer drug interactions. So I think it's B. Bleeding without excess ischemic events in this group. Dyspnea ticagrelor का है more effective in preventing.
25
Beta.
seconds. Which one?
B, beta.
B beta. Okay, so I'm going to lock B beta. Let's see what happens. Lock it, please. And yes, again you've gotten this one right. It's a beautiful stroke, and this has been flicked for a 6. Well done. Very well done. So again, The scoring streak is up again. Good. And with this, we have a score of 48 with one wrong answer. And we still have one more question, the last question to go. Can we have question number 10 on the screen, please?
In patients for greater than 75 years with end-STEMI ACS and high bleeding risk who require PCI, which stent type has the strongest evidence for allowing shortest guideline endorsed DAB duration without excess stent thrombosis? A. First generation test. B. Second generation Zotarolemus eluting stent. C. Bare metal stent. D. Second generation everolimus eluting stent. Or E. Bioabsorbable scaffold.
And your timer starts now, 60 seconds.
Everolimus नहीं? Everolimus हमारी होती है. Everolimus उसका generation. मुझे तो Evro याद. I am not sure. मुझे तो चला गया बस. ज़ोटारो कौन सा वाला? भी नहीं. कौन सा वाला? और Evro जो हमारे रिफ्यूज होगा. अरे Evro.
Bioabsorbable था. Metal भी नहीं. D delta, second generation everolimus eluting stent.
Okay, so you want me to lock D delta. How sure are you?
50-50.
He says 50-50. Let's see when he's 50-50 what happens. He wants us, in fact, they want us to lock D delta. Lock it. And your 50-50 is 100%. You're absolutely right. Well done. Very well done indeed. And with this, we come to the end of this game. And I tell you, I was really excited to see the way the questions were answered. Very well done. And we know that they've put up a score. AFIC Lions have won the game. And they have scored 54, whereas Dow Dolphins had scored 36. And with this, I think only one mistake made by AFIC Lions. And in this game, they have won the game, by virtue of which, since it was a knockout game, they have progressed. And now AFIC Lions move into the quarterfinals. Very well done, AFIC. But I would say, Dow Dolphins, you also played very well. And the way you both have played today, we have thoroughly enjoyed, all of us. And with this, I'm going to move to Professor Isaaq Saab. Sir, your thoughts.
Thank you very much. I think they have done very well. I mean, AFIC, just one mistake out of 10, और वो भी शायद थोड़ा सा concentrate करते तो ठीक हो जाता. बहरहाल, they deserve my compliments and congratulations. The other team also needs to be complimented for their fight, and they should not lose heart. It's a learning exercise, learning experience. And of course, when there are two teams in the field, one has to win, the other has to lose. But lose doesn't mean that you should be discouraged or you should be not taking part in future competitions. So I think the question was quite straightforward. Scenario was average routine scenario, and answers were good. In a way, I think they were lucky that their scenario was slightly easier than the one which was faced by Dow Dolphins. It's my personal opinion. I want to be very just and unbiased. But I think luck also हर एक को तो नहीं मिलती, जिसकी अल्लाह जिसको देता है उसको मिल जाती है. So I think well done, Lions, and my congratulations to all of you, especially you, for excellent performance as a moderator, and Messrs. Wilson Pharmaceuticals for their logistic and organizational support. And of course, Professor Hafizullah, thank you very much for being with us. And the two absconders are two brigadiers who have left the scene without telling us. So I think my regards to them as well. So on the whole, it was a very interesting match. And once again, congratulations to AFIC Lions. Thank you very much.
Thank you very much, sir. I think you're such a quintessential part of this league, and you are the soul and somebody who keeps the show alive. Professor �ishaq Saab, thank you so much for all your comments and for being there with us. And I think I would now like to move towards our other stalwart, Professor Hafizullah Saab. You know, he comes like a light onto the screen, and I think he's the light that we have to guide all of us, sir.
Thank you, thank you. I think it was again a very well played round by 3 lionesses and 1 lion. Very important to emphasize on that lionesses are also equally important, if not more important. And they played very well. I think both questions, one on semi and other on non-semi, were very nicely crafted, and they were very nicely. So I think they were very important lessons to learn. And this game and all this show will be reaching its utility if we can apply the lessons learned today into our clinical practice, and if our patients can benefit from it. So I'm very impressed with the profundity of knowledge on both sides. And of course, I think they both performed very well. But of course, AFIC, supported by the 2 brigadiers, did extremely well. Congratulations to them. And of course, you all played as a very honest sort of a broker, and you played your inning very well as well. Thank you very much.
Thank you very much, sir, for your comments. I think it's our faculty members and our seniors like you who actually keep us going, whether it's this field or it's the cath labs or it's the hospitals. And I think the way you've been guiding your students and all of us, and now, you know, we all have the responsibility to do the same with our trainees and our students. And it's a big responsibility, but we all have to play the innings properly. And may Allah give us the strength and the knowledge to do it. And I think our youngsters, they are doing a wonderful job in every field, as we can see. And it was a wonderfully played match, and I think beautiful question setting. There's a lot of effort that goes into it by our reviewers, by all the people who make these questions, and these are indigenous questions. They are not copied from anywhere else. They come up with the questions, and they are absolutely created for this league only, and authentic sets of questions. So wonderful effort, and I think the credit goes to Wilson's Pharmaceutical for coming up with all the logistics and making it happen. With this, we also have Abdul Hamid Siddiqui Saab. Okay, so I think Siddiqui Saab may not be there. And do we have any other faculty member? Dr. Amber Ashraf is there. Ma'am, can I see you there?
Assalamu alaikum. How are you?
I'm good. Alhamdulillah. Great to have you. Did you see the match?
Thank you. Yeah, thank you very much. I missed the first half, but I joined you people in the last one due to my internet connectivity. But that was a wonderful thing. And congratulations to both of the teams, and especially to AFIC. And I think so the unity, faith, and discipline really makes a difference, because the score is really wonderful. I've really enjoyed the comments of Professor Ishaq and Professor Hafizullah Saab. No doubt these are the mentors, role models, and we are trying our level best to follow their footsteps. Always I enjoy your commentary, and I wish I can do the things like you. And secondly, thank you very much, Wilsons, and especially the way they have generated this another link for all the PGs. They can come and join and give online answers. That's a wonderful thing. Thank you very much for all that. I have really enjoyed it. Thank you.
Thank you very much,
Be
ma'am.
careful. Your job के ऊपर नजर है मैडम की.
Very. Oh sir, I think
मैं जॉब एंजॉय कर चुकी हूँ, लेकिन अब हमजा जिस तरह कर रहे हैं ना, I really appreciate that.
I agree with you.
And
I
motivated.
agree with you.
Thank you very much.
I think he showed up on his channel. and he will make a better living there, you see.
Thank you very much, sir.
तो वो
And
जो हमजा साहब जो हमारे फौजी दोस्त हैं ना, वो गए हैं बनियान मरसूस लड़ने के लिए.
सर लग तो यही रहा है क्योंकि वो जब आते हैं उसके बाद गायब हो जाते हैं. आई थिंक नेक्स्ट टाइम वील हैव टू somehow get hold of them and make somebody sit with them.
जी बिल्कुल.
So but sir, I think not all of them. I do somebody extremely important, and I think thank you so much for all the comments. I think it will be an honor to have ma'am here and doing it for us. I think she's a stalwart in her own right.
Please,
And
Hamza,
Sir.
please note all three are from KPK, from Peshawar.
Very rightly pointed out, sir. Very rightly pointed out. And I think Peshawar, mashallah, KP is doing a wonderful job. We see, we saw what they did over there with the Tavis, 14th August, wonderful performance, 14 out of 14.
I think this is probably an appropriate forum to announce that they did 14 Tavis in one day. But the beauty of that is that we had excellent operators from Karachi, from Lahore, from Islamabad, Pindi. So it's not really effort of only PIC. It is the joint effort of all the interventional elite. And I was so impressed to see them. I was luckily there to see them all working so closely. So I think the beauty lies working together and helping each other. And that was, I think, a major leap in the understanding of doing procedures, because all of them were helping each other. And the learning was massive. So I'm very, very happy about this, what Ali Raza and Abed, they took it together, and Suhail was there, and Nadir was there, and Asad Akbar was there, and so was Naeem was there, so was
Asim
Saab. Yes, all of them.
Everybody, mashallah. So wonderful. Thank you for announcing it. Thank you.
Thank you very much, sir. I think this is, we are all so proud of this. We were sitting over there. In fact, we all wanted to be there, but only a few can go and do it. And we were praying that, everything had gone according to the plan. And I think kudos to the team over there, the whole interventional society. And I think extra, I would say, commendations to the whole Peshawar team, Dr. Ali Raza, and he led it from the front, and Dr. Waleed, and all of you who were there. I think this is an example, and we as Pakistanis and interventional cardiologists are so proud of this feat and this achievement. True embodiment of togetherness and unity. Brilliant and wonderfully explained.
Dr. Hamza, I just want to add one thing. I recall the days when Professor Dr. Hafizullah and Dr. Riaz Anwar Saab has started this land and then all the work for this PIC. And now, mashallah, after 2 decades, the things are coming up, और दरख्त पे फल लग गया है, पक गया है, और सब खा रहे हैं, enjoy कर रहे हैं. Thank you very much for all that thing.
Thank you, and thank you. So I think we can never thank you enough, sir, for this wonderful.
Yes, I think, Hamza, I would also like to pay my gratitude and compliments to Professor Hafizullah for this great achievement that was done at PIC. And among the photographs I saw Asad Pathan.
Yes.
He hardly travels outside Karachi.
Anywhere.
He hardly leaves his cath lab. So you made him come to Peshawar. that was a great thing.
That is wonderful. And Hashmi Saab and Noman Nasir, they were all there and they worked so nicely. I was really very impressed.
Thank you very much, sir.
और अल्लाह ताला बरकत डाले, शिफा डाले.
Ameen.
Thank you very much, sir.
With
Thank you
this,
very much.
I would like to take your permission and Hafizullah Sahab, Assalamu alaikum.
Thank you, sir.
दुआ में याद रखिए, दुआ में याद रखें, और
Always
अल्लाह ताला
nice to see you.
आपको सलामत रखे. और
Sir, just a few. Right, sir. We do have the coach of AFIC, Colonel Azhar Ali. I think he's there, and we'll just take a few moments to take his views.
Yeah, let's see what he has to say.
Okay, so I think.
वो भी चले गए.
leaderboard for those players who were actually playing remotely with us from Khyber Teaching Hospital and NICVD, and these are the three names. So we have the top scorer Osama with 4 out of 10, and we have Farhan on second place with 2 questions which were correctly answered, and it's Neelam with 1 question correctly answered. So these are the leaderboards. I'm sure that these numbers will improve as the involvement it also increases. But I think with this we come to the end, and again, so we all know the outcome. So AFIC Lions have actually progressed and they have moved into the quarterfinals. Congratulations to them. Commiserations to Dow Dolphins. But I think in a way they are also winners because they played really well. And in the end, we all know on that very day, one team wins, but the other team in this particular scenario, in these matches, they also take a lot home, and in the end, and at the end of the day, we are all winners and we are all learning. So thank you very much for your time, your presence, and I think we are coming to the end of this match, but this league has a lot more in store for all of you. So stay tuned till the next time we see you. Until then, it's Allah Hafiz from my side.